Hey Sean, it's just like it sounds. I field questions from the tribe, and they usually start the question with the words, "Hey Sean." Double decker today. Two questions that are completely and directly related. How much experience should an RN have before they apply and enter and become a nurse practitioner? I'm going to preface this by saying I'm an old school nurse, or I should say I'm a little bit more seasoned than most of the current generation. Back in the day, you couldn't even apply to NP or CRNA school until you had 2 years of experience. That was when I was a baby nurse. I can remember specifically my second job as an ICU nurse working in a very large level 1 trauma unit. Nurses would rotate through this unit to get there 2 years. The whole idea behind the 2 years of experience is that, generally speaking, it takes roughly 2 years for you to get comfortable in your new nurse skin. Once again, it's a rough estimation. There are many nurses who find their way much earlier than 2 years. And on the flip side, there are a lot of nurses that take more than 2 years to find their rhythm. It takes them longer. It's that magic moment when you go from saying, "Oh shit," to "bring it on." And it's not an announcement. It isn't something that you cross over some sort of invisible threshold. It's just a moment that everybody celebrates in a different way and recognizes in a different way, but it happens and you don't even know it happened. You go from being the frantic chicken with their head cut off to being the calm and organized lifesaver. You by far still need to learn a shitload of stuff, but you're no longer rooting around like you don't know what's going on. So this is why they picked the 2-year, or they had picked the 2-year mark for when you can apply to be a nurse practitioner or get into NP CRNA school. And it makes complete sense because you're advancing your career, you're going to be delegating, you're going to be becoming a leader in our profession. And quite honestly, you're going to be the person that has to answer all of the questions that come up at the bedside. You no longer get to just say, "Well, I'm going to go find the doctor." As an advanced practice nurse, you're going to prescribe scheduled medications, you're going to order diagnostic imaging studies. You're going to have a greater responsibility as an advanced practice provider. So I don't know about you, but when you first start this profession as a baby nurse, do you feel that you should be given those responsibilities? I think back about how confused and scared I was as a baby nurse within those first 2 years. And would I have been able to practice as a nurse practitioner in those first? Yeah, I don't know. That's tough. I'm gonna probably say no. I was not prepared, nor was I ready for that. So here's the argument, is that the requirement used to be 2 years before you could even apply. Given our state of the healthcare system and the nursing shortage, which has extended its arm to the advanced practice provider world, I don't think many schools still adhere to the 2-year minimum before you can apply. I don't know many schools that do that anymore. I think I've seen 1 year, and quite honestly, I'm pretty sure I've seen 6 months. 6 months of experience before you apply. Now stay with me here. That's just to apply. All that means is that you've been a nurse for 6 months and you can actually submit your application and you can sit for the entrance interview. If you had to walk it out, that means that you probably would not graduate as a nurse practitioner until you had up to 2 years or more experience. Average NP program, if you're going with MSN, is about 2.5 years, 3 years. DNP is almost 5 years. So theoretically, you wouldn't graduate and actually start practicing as an NP until you had almost 3 years of nursing experience under your belt. I still think that is like the bare minimum of experience to be a confident advanced practice provider. But that brings up a whole nother argument about, NPs fulfilling the role of physicians during their shortage. I mean, as a patient, do you feel comfortable having someone with less than 3 years of experience make those kind of decisions about your health? I don't. Sorry. I'm all about advocating for nurses, but nope. There's no way you can care for a patient in a safe and effective manner with that little of experience. Ergo, the reason for the old school 2 years of experience before you could apply. Old school mentality, that would put you at around 5 years of nursing experience before you became an advanced practice nurse. So the very long-winded answer to the question is, I do not feel that an RN should go immediately into NP school without at least a year of experience. Meaning you've been an RN for 12 months, you can now apply to an NP program. RN for 12 months and an NP program is going to last you averaging 4 years? Yes. I would be confident as a patient you taking care of me. I mean, the argument being, the more time in grade you have, the more knowledgeable, skilled, and confident you are going to be. This is the reason why physicians go through the rigorous and lengthy training they go through. And this is the argument that the physician community has when it comes to NPs fulfilling the physician shortage in the primary care world. Can a nurse with 4+ years, 5 years of experience, nursing experience, replace or fulfill the role of a physician? A physician who has an average of about 10 years of rigorous medical education and training. Things that make you go, And this is coming from someone who is a passionate advocate for nurse practitioners and is a nurse practitioner himself. What says the tribe? What do you feel is an acceptable level of experience before someone either applies or becomes an NP? And I want you to answer this as if you were the patient. I don't want you to answer this as a fellow colleague nurse. Answer this if it was your family member. Hell, answer this if it was you, the patient. If you were the patient, what do you consider to be the minimum amount of experience? Send me your message. And as always, check your own pulse first.